Hi guys, Dr. John. Welcome back to Shooting Up in the Dark. This segment is called Cut-Off, How to Survive Involuntary Opioid Cessation. And it's meant to come in sequence after the previous videos, also on the topic of being cut off from long-term opioids if you are a chronic pain patient, and all of the issues around that. But this segment is meant to be practical, and I hope that you will gain encouragement and hope from it and be able to follow some of these suggestions if you find yourself in the scenario of needing to stop your long-term opioid medications because your doctor is insisting on it. So if you're in a situation where your physician is telling you that you need to stop your opioid medications because he or she is going to stop them for all of their patients or whatever reason they give you, as described previously, there's a political movement in this direction, an anti-opioid movement, and people who are on opioids for chronic pain are being cut off, and it's inevitable in some cases. And even though I think this is a travesty, it's the reality. So if you know that this is on the horizon for you, here are the things I would suggest you try. First, try to avoid stopping the opioids unless there is a good reason to. Appeal to your physician, talk with them, try to reason with them, maybe request referrals to another provider or a colleague, another physician who is able and willing to prescribe your long-term opioids. And consider contacting advocacy organizations, chronic pain advocacy. This opioid access crisis, as I call it, is a national problem, and you have lots and lots of companies, millions of people facing this scenario who have already been cut off and are going through consequences. So that the support of these organizations and support of people around you is really important. If it's unavoidable and you know that you're going to be stopping your chronic opioid medication, you can't get them anymore, your doctor won't prescribe them, then discuss a plan, discuss how this is going to be done exactly with your doctor. Now, your doctor is likely to not be as informed as you are regarding what all the potential pitfalls and consequences of stopping your opioids are for you, but you know, and you need to have a plan nevertheless. So sometimes opioids are stopped abruptly and sometimes they're weaned off slowly. And truthfully, both are difficult. Intuitively, it would seem that weaning is the better option, and it is in terms of avoiding the most acute aspect of the withdrawal illness. But depending on how acute withdrawal is to be handled, sometimes people would prefer that route, the acute cold turkey approach, doing it all at once, because weaning still involves risk, and while you won't likely become as acutely sick or miserable as in the cold turkey approach, a moderate level of illness and misery is still likely, and it'll last for weeks or months rather than days. Again, I would refer you to the TED Talk by Travis Reeder on the agony of opioid withdrawal and what doctors should tell their patients about it, where he describes the experience of being weaned off from his opioid medication. Next, I suggest obtaining referrals to discuss your specific situation with both a pain specialist and an addictionologist, an addiction specialist, and if possible, having these consultations before your medication is stopped. The reason for discussing with a pain specialist, there really are two reasons. One, he or she may, if you're very fortunate, be knowledgeable about a cutting-edge new treatment for your specific type of pain that could make a big difference and should become part of your pain plan. And number two, there's a chance they may be willing to continue your opioid prescription even though your primary care physician is not, depending on their political persuasion about these things. And consultation with the addiction specialist is not because you're addicted, but because addictionologists are experts in the management of opioid withdrawal, and you are about to go through opioid withdrawal, even though not from heroin or fentanyl like a lot of addicts do, but the symptoms are still the same. And this specialist may be able to provide you with help and help design your overall withdrawal plan. potentially prescribe medications to help with the symptoms of withdrawal and just be a great resource. Next, as I mentioned, you need to have an overall acute opioid withdrawal plan for yourself and plan ahead for yourself how and where you're going to withdraw. So make a withdrawal plan. Many people do go through withdrawal at home, but hospitalization or admission to a detoxification facility is definitely worth considering. Understand that with acute withdrawal is a similar experience regardless of which opioid a person was used to taking, or how or why they used it, and whether or not they were a chronic pain patient or an addict. Detoxification in a safe professional environment is appropriate for people who are stopping opioid medication. Those facilities are not just for addicts, and they have several advantages. So this is, again, something to speak with your addiction specialist in the consultation about. Or if you can't get a referral to an addiction specialist, you can just request a consultation at the most local, reputable treatment center, and they can assist you. Now, let's just assume that you will be detoxing at home, even though I'm not necessarily recommending that. The reality is that is what happens often. So if you are going to detox at home, don't be alone, especially at first. You need people around for several reasons. You need support, emotional support. You need monitoring so people can watch you and help you through the withdrawal. You may become delirious and disoriented. So treat it as an episode of serious illness, which could be worse than expected, or become complicated, which will last about a week. This person or group of people can monitor you, help implement the withdrawal plan, including any adjunctive medications for symptoms, keep you hydrated, and if needed, call the doctor or take you to visit the emergency room. Recognize that you may have intense craving for your opioid or any opioid during acute withdrawal. This is just normal. Make sure whatever you do not take an alternative opioid and that no one offers one to you. Those who will be helping you through the withdrawal should have an idea what to expect and to understand all aspects of withdrawal, including why you may feel a desperation to take an opioid while withdrawing to lessen the impact or to lessen the symptoms. And often this just clouds the entire withdrawal picture, prolongs it, and in some ways can be dangerous. So unless your withdrawal is supervised or it's a weaning program where a healthcare provider is prescribing you an opioid through the process, don't do that on your own. Now, after a few days, the severity of the withdrawal symptoms will peak and start getting better, thankfully. So you'll be able to eat, move around by yourself, and you won't need as much immediate close monitoring. But there'll be lingering effects of acute withdrawal, including weakness, depressed mood, sleep difficulty, cravings. So I recommend that you follow up with your doctor a week later and let them know how you're doing, that you still engage your support groups and with your friends closely. I haven't gone through what all the opioid withdrawal symptoms are, but this is covered in other videos, and it's also easily, you can easily find this information on the internet, but it's common to have gastrointestinal problems, nausea, vomiting, diarrhea, to have a feeling of a fever, temperature, lability, delirium, severe achy bones, sometimes a lot of abdominal pain. But what's honestly worse even is the psychological symptoms, the sense that you're dying, the sense that of being terrified and alone. And for some people, this is the worst part. And so having other people around and being in a supportive environment can really help. Now, when the acute withdrawal is over, expect an ongoing phase of which we could call the readjustment phase. And during these, anticipate that there may be additional items you have to deal with during this readjustment. So you need a plan for this phase too. Now, it's impossible to predict for you exactly what things will be like. It depends highly on the individual and particular situation. But here are some common issues to consider and possibly anticipate for. First, pain. The pain which you took the opioids for originally may return, and it's probably a good idea to expect it to return. So make sure that the pain that you have is has an updated evaluation, and the new pain you have is evaluated, so that consideration for any alternative or new therapies can be instituted. Any non-opioid type of therapies. I suggest a broad approach to treating your pain using all kinds of therapies, whether they're medical, alternative, Chinese, etc. Next, think about your functional status. If the pain does return, it's possible that your mobility could be compromised. And again, you really won't know for sure until it happens, but may want to prepare for that. Next, in terms of mental health, this can be challenging and discouraging, of course. That's normal. So I definitely suggest that you have the support of a therapist, that you're open and honest with your friends, and that you get treated if needed for the mental health aspects of this. I want to mention the possibility of craving, even for persons without addictive tendencies. You may find yourself craving the opioid withdrawal. You may find yourself craving the opioid drug during or after withdrawal, or being obsessed with having it. And some people are tempted to take an alternative opioid not under a professional guidance, and this is never a good idea. This is another reason why you need support, give feedback, talk with your doctor again. And the craving could be indicative that you have a legitimate need and desire to go back on the opioid, if this is the best thing for you to do for your quality of life. And I would go back to your physician and bring this up, that maybe you should be on an opioid. Depending on the political environment and how the pendulum swings, your physician and all physicians may be more open to this. The craving could also indicate an unhealthy relationship with a drug if you're looking for ways to obtain and use secretively, obsessing about it. And know that people can and do develop addictive behavior at any point in life. In some cases, after getting off of chronic pain medications and trying to endure that, during that situation, it can be tempting. People can and do develop addictive behavior at any point in life. In some cases, craving for opioids and having a risk for addiction combined with severe chronic pain can be a reason to try newer medications, which are called opioid agonist antagonists, such as buprenorphine. Obviously, this would be done in conjunction with your doctor, probably an addiction specialist. These medications work in such a way that addiction to them is unlikely, but cravings are reduced. There is no high. Other opioids will not work on the brain, but pain sensation is blocked to a significant degree. So consult an expert about this possibility if you find yourself with difficulty with ongoing cravings and pain. Please just be aware of the risk I mentioned of turning to addiction, as discussed elsewhere. One reason why the indiscriminate termination of chronic pain therapy is generally unhelpful is because it can completely backfire for some folks, especially people who don't have a lot of support or resources. And in the midst of severe withdrawal and misery, or a sense of desperation can develop, in which some people find and use opioids outside of the medical care system. And often this starts as just a desperate attempt to find immediate relief from physical, emotional, and mental pain. But it quickly becomes addiction, and it's more common than realized. So this is the biggest danger in stopping opioid therapy when there's not a good reason to. And I just want you to be aware of it and to certainly discuss any of these feelings or cravings you may have. Everyone should be warned, too, that overdose can occur at a much lower dose of opioid than someone had been taking or using before stopping. After stopping, dependence on the opioids gradually normalizes, such that the amount of opioid one may have used before is way too high and will have a vastly more acute effect on the brain, even shutting it down or causing overdose. So that's just a warning. And it's important to recognize that there is a susceptibility to abuse of opioids and addiction in the aftermath of opioid cessation. And it's important to be proactive with a plan for both the acute phase and for the readjustment phase. Hopefully, these symptoms won't be as severe, or you won't have all of them that are described, but you have a right to know what can occur and to be prepared. I would, as a final thing, say that this is a difficult topic, and it can be scary to anticipate going through this process, but you should always be open about what you're going through with your friends, with your advocates, and feel free to go back to your doctor and let them know what's really happening. Because your doctor, like I said, may not realize what this means for you. And as they see what's actually happening to their patients, if this doesn't go well for you, they need to get that feedback. And I think that's really important. So this is a topic that a lot of people will want to discuss. I'm happy to try and discuss and respond to your questions online, or make any additional videos which you think would be helpful. Thanks so much for participating, and see you again soon.